So for the cardiorespiratory assessment, the Queen's College Step Test is selected to assess his cardiorespiratory fitness. Okay, so this test will require him to step up and down on a standard height step. So the period of the test will be 3 minutes. Also, the recovery heart rate will be taken after the completion of the test. So the purpose of taking his recovery heart rate is to use it as prediction of his aerobic capacity. So in simpler terms, the lower the heart rate, the fitter the case study is. Okay, so the equipment needed are a step platform which is already set at 41.25 cm outside the it's already prepared outside. Also, I'll be using a metronome app to track the number of steps. And lastly, also a blood pressure monitor, and I will be measuring his heart rate manually. Now I'll be briefing him through the indications for terminating the assessment. Okay, so during the assessment, at any time if you experience angina-like symptoms, you have to let me know. If you experience a sudden drop or rise of blood pressure, just indicate to me. Also, I'll be looking through if you have any signs of poor perfusion, lightheadedness, confusion, or like cold clammy skin. Okay. Also, if your heart, I will also be monitoring your heart rate. So if it fails to increase with the increasing intensity, I will also terminate the assessment. At any time, if you're not comfortable and you request to stop, please feel free to do so. Okay. Now I'll be measuring his resting heart rate and blood pressure before the test. So you just rest your arms here. I'll manually track your resting heart rate. So just relax. Okay. Alright, just hold on while I'll calculate your results. Okay. Next, I'll be checking his blood pressure reading also before the test. Okay, just bring your hands in. Yep. Okay, so just lean back, relax, try not to talk or move during the test. Okay, so I'll record down your blood pressure reading. Okay, so based on the pre-test measurements, his heart rate reads at 72 beats per minute, whereas his blood pressure is in a normal range of systolic reading of 115 and diastolic reading of 75. So he is clear to go. You feeling okay? Alright, so we'll be proceeding to do the test next. Okay, so to perform the Queen's College Step Test, we'll be required to have a few equipments. Firstly, a metronome and a stopwatch. The metronome will be set at 96 beats per minute, and I will time the stopwatch for 3 minutes. That is the assessment time. Next, I'll be needing a step platform, which is already set at 41.25 cm. Before we begin the assessment, I will go through with my case study a series of dynamic stretches to prepare him for the exercise. According to the ACSM guidelines, warm-up is important before every assessment. This is to prepare him for the assessment ahead. Now that the case study has completed the warm-up, I'll be going through a demonstration to show him how to perform the assessment. Okay? So as you can see, the metronome is already set at 96 beats per minute. I'll demo to you one time, then you give a trial run. Okay? So I'll turn on the metronome. Okay, from here, simply get the whole step up the board. Okay? Follow the metronome. So up, down, down, up, down, down, up, down, down. At any time, make sure you keep your eyes forward throughout the assessment. Make sure when you step on the step, your whole feet is on the platform, and then go up. So up, down, down. Okay? Try not to round your shoulders. Keep your posture upright, and throughout the test, make sure your breathing is natural. Okay? Don't need to overly exert or deep breaths. Okay? You want to try one time? Okay, we try for maybe 4 reps. Okay? In 3, 2, 1, go. Alright. One more. Okay, that was well done. Some things to take note. Ensure your whole feet is on the step. Okay? Other than that, your posture, your breathing, all is good. Okay? Now that the case study has gone through one round of demonstration, he will be getting ready to do the actual assessment. So as a safety measure, I'll be positioning beside him to catch him in case if he loses balance or misses a step. Okay, so you're ready? Again, the test will last for 3 minutes. Yeah, hold feet on the step, eyes straight, breathe naturally. Okay, I'll start the time in 3, 2, 1, and go. Up, down, down. Good. Up, down, down. Up. Alright, so far 1 minute has passed hanging there, okay? Good. Keep it going. Alright, 2 minutes has passed. Good, doing good job. Again, remember, make sure your whole feet is on the step, okay? Alright, we had the last 10 seconds. So again, once you're done, just stand by your pulse. I'll count down for you, okay? 3, 2, 1. Okay, stop. Alright, I'll count your pulse. Okay, can just rest. You'll cool down in a minute, okay? So 10 minutes has passed since he did the assessment. But before we do the last measurement, I will just go through the post-test measurement we took. So immediately after the test, his heart rate was at 119 beats per minute. Also, his blood pressure reads at 109 for systolic and 72 for diastolic. So now we will do a post-test measurement. So the purpose of this test is to make sure that his heart rate and blood pressure has returned to normal levels and he is cleared to leave the assessment area. Okay, so first one, I'll do your heart rate. Okay, hold on, I'll tabulate the results. Okay, so your post-test heart rate has returned back to normal level, which is 76 beats per minute. Now we'll check your post-test blood pressure reading. Okay, so just stay still, try not to move or talk. Okay, blood pressure reading looks good. Your systolic reading is at 98 beats, 98, and your diastolic reading is at 66. Okay, so you're feeling okay? So if you feel okay, 10 minutes has passed, you're free to go already, okay? So the next assessment would be your balance assessment. Okay, thank you.